Great, thank you very much. And recording has started, so that's a good sign. And I'm going to share my screen with you all. And hopefully you can all now see a screen in front of you rather than lots of people. Is that right? I get thumbs ups. Excellent. Luke, feel free at any point to give us a sign if sound disappears or if visuals disappear or anything like that. But otherwise, thank you very much. It was lovely to see so many familiar faces, all my friends in the UK, and to see Anna Jansen. It feels very strange for us. I'm sitting on one side of the world in Cape Town, and she's sitting in a very different part, and you're all sitting in different sections, and yet we're connected. So we're very happy to join you in this session. I should say, we're very keen for us to have chance for discussion and questions and answers, because nobody's an expert in COVID-19, as you know, or rather, we're all experts in COVID-19 because we're all learning it together. So I think there might be lots of learning that we can also do from one another as we go through the session. So I should firstly start by saying happy Global TSC Awareness Day to everyone. Today is the 15th of May, and I'm really happy that we were able to do something that includes global awareness on the very important day for our global community. So I hope you've all been celebrating TSC together. And the second thing that I should do is to say greetings from Cape Town. Here's a nice picture of Table Mountain, and you can see in the middle distance is the University of Cape Town, where I'm based. And right in the foreground, if you can see it, actually, this is the Division of Child and Adolescent Psychiatry. So this is where my clinic and all my research activities happen, if you see me. And then from beautiful Cape Town, I haven't seen much of the mountain either, because we're also in lockdown, from bottom of Cape Town to a different place.
So welcome to Belgium. I'm presenting from, well, actually I'm cheating because I'm presenting from home in Antwerp, but I work in Brussels. And this is a view of the entrance to the Children's Hospital in Brussels.
Very nice picture. Lovely. Good. And so, as you all know, Anne and I have for many, many years been interested in tuberous sclerosis, and particularly in what we now call TAND, the TSC-Associated Neuropsychiatric Disorders. And for many years, we've been doing research and studies and clinical work in TAND. And many of you will be familiar with the TAND checklist. It was one of the things that we've been working with in the TSC community, and all sorts of other things in participation with the TSA and with many parent organizations around the world. But as you all also know, something rather strange happened at the end of last year and the beginning of this year. And the whole world has really been changed by COVID-19. Some people call it corona or coronavirus. COVID-19 is the term that I will use for our discussion. And I really think, oh dear, remind me later, apologies there. And I really think it's useful for us just to think what's happened to the world as a result of COVID-19, what we can learn from it, not just in terms of challenges, but also what might be good things to come from these realizations. So I'm going to try and make sure we talk not just of challenges, but also of some of the positive things. So this is what we thought we would do today. I would start just with some general observations about COVID-19, and then try to look a bit at TAND, these TSC-associated neuropsychiatric disorders, through the COVID lens, and then talk a bit about the TANDem project, which is one of the projects that Anne and I are involved in, and that's co-funded by the Tuberous Sclerosis Association in the UK. So let me start before I hand over to Anne. I'm going to make 5 very specific observations about COVID-19 and then a general comment about it. And here's observation number 1. COVID is everywhere, in all regions, in all countries of the world. People thought it wouldn't get to Africa. It's everywhere in Africa. There's no one country in Africa that doesn't have it now. But it's been quite variable in severity. It looks as though it's more adults than children, although there are some very particular phenomena that we're now seeing in kids. But there's been huge confusion about the language around COVID-19. Symptoms versus confirmed cases, screening versus testing, and all sorts of things. And this has led to lots of confusion. Every week you listen to the Prime Minister in Britain, and every week we listen to the President of South Africa. People are confused again about what it means and what should and shouldn't happen. And the word uncertainty is a word that I'm going to use a lot of times, because uncertainty is really one of the key themes here. Here's just a picture from today. I'm sure many of you are familiar with the Johns Hopkins University website, where they have a dashboard of all cases of coronavirus around the world. And so today, earlier today, over 4 million cases around the world, just over 300,000 deaths around the world, and everywhere, every continent and country has been affected in some way. The second specific observation is just how striking all the fake news and the infodemic has been about coronavirus. You've all heard about weird proposals for causes and treatments and vast amounts of information. Every day we're bombarded with information about COVID-19. And the information changes from one day to the next, from 1 week to the next. 1 week we don't need to wear masks, the next week everyone has to wear masks, etc., etc. And these things too, the changing of information has really led to a lot of uncertainty as well for people in the global community. Here's just one of my favorite examples, a suggestion a few weeks ago, so that just drinking or taking in disinfectants or injecting it even might be a treatment for coronavirus. Now, of course, this was a very dangerous one, but there are many other. I'm sure you've all heard all sorts of stories about what might treat it. In Africa, the president of Madagascar is selling some tonic that comes from Madagascar that he says will cure it. In some other African country, people said if you alcohol down the throat, in other words, drinking cognac or whiskey will disinfect your throat and will prevent you from getting coronavirus. Now, it might give you other benefits, but it's certainly not going to do anything to the coronavirus. So all sorts of really strange things that have emerged. The third interesting observation is that responses in different countries to the virus has been very, very different in terms of screening, in terms of testing, in terms of how people have done lockdown. And it's really shown us just how variable information systems in different countries are, how variable expertise in different countries are. And I think it's really put a spotlight on the weaknesses in health systems around the world. And you've experienced that in the UK, and we see that in many countries in the world too. So if we just look, my little map, I just put up four flags here. In Sweden, for instance, as you know, Sweden has basically not done a lockdown. They've said we have responsible citizens, and that's been their strategy for managing the virus. On the other hand, New Zealand had a very quick, very rapid lockdown, and that was how they managed their crisis. Britain, well, it's been quite changeable, but as you know, testing at first started only in hospitals with ill people, and then to key workers, and now it's becoming perhaps more available to others. And lockdown, well, we can write many books in the future about lockdown regulations in Britain. And in America, every state has had their own lockdown rules and approaches to screening and diagnosis. So that's also led to lots of confusion and uncertainty in the world. One very striking thing, and we've experienced it tonight as well, is how everyone has gone to technology to connect to people, to friends and family, to connect to information, whether good or bad, tracing contacts. I see there's also discussions about apps that can trace people for education, children going to school with streamed classrooms and those kind of things. But what it has also done is it's really emphasized what we call the digital divide. And I'm going to show you the next picture to describe that digital divide. So here's a map of the world showing internet users as a proportion of a country's population. And you can see in a place like Britain or most Scandinavian countries, most people, 90 to 100% of people have access to internet at home. But if you look at many other countries of the world, and particularly if you look here at Africa, the average is actually very different. In Africa, only about 10% of families have access to internet at home, which means if we're trying to use technology, drive to technology because of COVID, it really emphasizes that divide that we have. Now, of course, that divide also exists within countries and within communities too. And my observation number 5 is really that the burden of this coronavirus on families has been enormous. Even just in the pre-conversations, I heard you talking about the challenges of self-care, the challenges of care for children, particularly when you have a family member with a disability, the economic burden, the emotional burden on families and on individuals has really been very striking. And so I quite like this picture when I saw it. I think many of you have felt like this in the last month or so, where you're trying to clean and get information and answer and do work and look after the children and cook. And it's actually been a really overwhelming feeling for most people around the world who've been in lockdown. And my general observation about all these things put together is about the psychology of uncertainty. And I'm going to show you a slide what I basically mean by the psychology of uncertainty. So it goes something like this. So whenever there's an uncertain event, or when we don't know what the outcome of something might be, it elicits a range of predictable, some helpful and some unhelpful responses in all of us. And so here are some examples. So in terms of thoughts and images that it might lead to us, it might make us have worrying thoughts, it might make us think the future is unknown, it might make us think the worst will happen, it might make us think I can't tolerate not knowing what's going to happen. People worry that they're not going to be able to cope when bad things happen. I have to be prepared at all times and at all costs. And that's associated with lots of emotions and feelings. And we've all experienced these in the last 2 months or so. Uneasiness, anxiousness, uncomfortableness. My main feeling has been one of irritability, where my fuse is shorter than it normally has been. And of course, often we also get these physical sensations of feeling sweaty and sick and butterflies in our stomach and heartbeat, etc. And it often leads to us having all sorts of different behaviors. You know, what we try to do when things are uncertain is we try to make them more certain. So we make lists, we plan, we over-prepare. I think that's why all of Britain has been buying loo rolls, because it's something we can do. You know, we can take control over that. We seek reassurance, we check, we overprotect, we do all sorts of things. And these are part of the psychological responses that all of us have in response to uncertainty. So let me now try and change the story back to TAND and just look through that COVID lens at TSC-Associated Neuropsychiatric Disorders. You know, and I know, and you live with it, TSC and TAND is everywhere. All regions of the world, variable in severity. The difference is it's both grown-ups and children who are affected by TSC and in TAND. And in TAND in particular, we've had just as much confusion about language, about terminologies, about symptoms, and about diagnoses, and about different levels of difficulties. And these things have led to lots of uncertainty for families and for many people who live with TAND. Just a few examples here from one of our TOSCA, the big international natural history study that many of you are part of as well, that showed that many people have behavioral difficulties, overactivity, sleep, impulsivity, anxiety, mood, all these kind of things. Many people with TSC have autism spectrum disorders, ADHD, and other psychiatric co-occurring conditions. But we have a huge mix of intellectual abilities in the TSC community. Many people have or have had academic difficulties in school, and often after school, even in their adult life, might still have some of these difficulties. And many people have very specific problems with their attention, with memory, with concentration, etc. So these are the phenomena that are part of TAND that we know about. In terms of fake news, well, I think in the TSC community, because people are uncertain and because we're looking for answers, people sometimes look for all sorts of strange treatments and strange explanations and strange therapies for their TAND. And sometimes that's helpful and sometimes it really isn't, and actually just adds to more uncertainty for us. In TAND, in TSC, as in COVID-19, national responses are different. So many of you are from different countries, and in different countries, people screen differently for TSC and for TAND, they diagnose differently. Many people really struggle to get access to any intervention for their TAND difficulties. And that's really a result of all these variable systems that we all work in. And I think conditions like tuberous sclerosis and other rare diseases really put the spotlight on where the weaknesses are in our health systems, in our educational systems, in our social care systems, because they all need to come together if we want to meet the needs of people who live with TSC and who have, particularly when they also have TAND. And of course, technology, we talk about that in COVID, and it's actually the same in TSC. There's a huge desire for people in the TSC community to try and find technological solutions, to find information, to connect, to train, to learn, and to improve TAND phenomena. But there are many challenges in technology too. So you've all experienced, I'm sure, issues with internet and speed and cost and data, and the internet makes one vulnerable to. There are good things that come with internet, but there are also risks. So one example is there are many people online who will sell you all sorts of treatments and interventions, and they'll say, this is something that will help you with your, whatever it is, anxiety or depression or autism. But many of those actually don't have an evidence base. So that's a risk. So we are vulnerable to being exploited through technology as well. And particularly when we think about apps and these kind of things, most of the wonderful apps that are advertised on the internet do not have evidence, so true, firm, strong scientific evidence. And I've already mentioned that digital divide that still makes it hard for most people in the world to access a lot of these things. And I don't need to tell any of you anything about the burden of TAND and of TSC on families. And you will all have experienced the burden of not just TSC and TAND, but now also the burden of lockdown on yourself, your own mental well-being, care for your family, the economic challenges of that, the emotional challenges of that. And that's really been a phenomenal impact on everybody around the world with TSC and with family members with TSC. And so when we take all of these together, it really, in my mind, comes back to that psychology of uncertainty that I talked about earlier. And if I imagine that I live with a rare disease, or you live with TSC and TAND, where we are uncertain about it, where we don't know what the outcome will be, I imagine that not just in lockdown, but in many weeks of your life, this is how you feel. And I imagine that many people who have children, or people who have autism, or people who have intellectual disability with TSC, this is how they might feel on a daily basis. Those feelings of uneasiness and anxiety and discomfort, and maybe lots of physical sensations, because we worry, we don't know, we kind of anticipate the worst. We try, and it helps me also to think how we might explain some of our own behavior and some of our children's behavior. We might deliberately want to do absolutely everything we can. We want to make every possible plan we can. We might want to do the same thing over and over and over again. We might want to check and seek reassurance over and over and over again, because it's all part of this psychology of uncertainty and trying to make certainty within all the uncertainties around us. I had a beautiful description this morning from one of my colleagues to say, it's important for us to think, what do I have control over and what do I not have control over? And she, for play therapy with children, they use a lovely analogy of a rock or a stone and a ball of clay. It doesn't matter what you do to this piece of stone, you're not going to change its shape or its characteristics in any way. And so there's probably not much purpose in trying to change that thing. And maybe COVID is a little bit like that. We can't change it. We can be safe and we can do safety distancing and washing and all these things. We are not fundamentally going to change that. But if we think of the ball of clay that is under our control, we can shape it and squeeze it. That is about our response to these uncertainties, how we find strategies to manage that. And I think that's a lovely analogy for children also when we say, why are things so difficult? Well, there are some things we can't change like a stone, and there are some other things we can change like a ball of clay. So let's think what the things are in the ball of clay that we can perhaps change. And so for many years now, long before coronavirus came, Anne and I and many of our colleagues in the TSC community have been thinking, what can we do that will make a difference to families who live with TAND and that will reduce some of these uncertainties of living with TAND? And that's really been the background to the project that I'm going to hand over to Anne now to tell you about, the TANDem project, because that's really been the philosophy behind why we got to this point in our research journey.
So over to me. So the TANDem project really started with Lauren Leclésio and the TAND checklist, and the development and the validation of the TAND checklist was really driven by Lauren, who was a PhD student with Petrus in Cape Town. And as part of her PhD study, she completed it also with the development of, or the identification, delineation of 7 natural TAND clusters. And after she had done all that work, developed the checklist, validated it, developed and identified the clusters, she went back to you and to the TSC community and asked, like, do you think we've done enough now to tackle this identification and treatment gap in TAND? That was the initial reason why this checklist was developed and why we defined the term TAND, TSC-Associated Neuropsychiatric Disorders. But no, it was very clear that more work needed to be done. And the questions or the goals that came back were to develop a self-complete and quantified version of the TAND checklist. So instead of having a lifetime version that we have on paper and that we use as a tool to facilitate a conversation between a person with TSC or a family and a caregiver, that's really the goal of the TAND checklist, to lead this interview and to give a structured situation to make sure that we really discuss all the aspects that are related to TAND and not just do a quick anamnesis or just a quick check and think like, oh, I think we've covered everything, but really to make sure that we get all the aspects and we really talk about everything. But then family said like, no, we would really like not to be all the time dependent on physicians and others, but we really like a version to be able to complete on our own, to self-complete. And we also would like to be able to quantify the different levels and aspects of TAND. So not just feeling like, did your child ever had a temper tantrum, but is your child having temper tantrums? And if yes, how much of a problem is this? If it's just once in a while, sporadically, it does not really hamper a lot, then okay. Or is this really something that is there every day and just turns your family upside down? In that case, it is something that has a lot of impact, and maybe we should be able to score it differently and prioritize it more. So self-complete and quantified version of the TAND checklist. And instead of having this just on a paper version, families clearly made it very clear that they would really like it to have it on an app on their smartphone, so that it was easily accessible. They have it with them, so to complete it and to whenever it is needed, and not to depend on waiting for a visit with a physician to have a formal assessment and have an evaluation and then be referred to maybe some therapist who then says, but I'm not an expert in TSC, so go back to see your physician, maybe you should find somebody else. So because of that, because of this treatment gap also, families clearly made it clear that they ideally would like to have tips and ideally evidence-based information and tips that make sense, to really things that they could do to tackle these different aspects of TAND. And so ideally, these tips and evidence-based information, this toolkit, should be developed and be integrated into the app, so that if you go to the app and you complete the the quantified version of your checklist, a cluster will show up. It will clearly show which issues are the most important, which come out the most, which have the impact. And then there should be a toolkit linked to that that could provide advice that people can already put in place or try to work with while they're waiting to have maybe a more formal assessment and maybe be referred to somebody who can also coach and guide them along the way. So that was the philosophy and the homework that Lauren was sent back with. And so this was really the philosophy of the TANDem project. And when Lauren passed away, I think Petrus and I, we really felt that we owed it to her to really make sure that what she was really so dedicated to and what she really wanted to make happen, that we could facilitate this work and try to make it happen. And through a coincidence of situations, we were able to send in a project application to give this project or to shape this project. And so we applied with a project with the goal of empowering families through technology. And here we are again, connected through technology, a mobile health project to reduce the TAND identification and treatment gap. And we acronymed it TANDem. And so in the next slide, I'll ask Petrus to move it forward. There are three big aims in this project. So the first one is very close to our homework: develop and validate this quantified and self-complete TAND checklist, so make sure it is also solid and valid, and design it as a smartphone app. And here I can tell you that along the way, we have now identified the company that will develop this app. So we're very happy that this has been identified, and it's really a very positive collaboration so far. And then the next level is to generate consensus clinical guidelines for the identification and treatment of the TAND clusters. So really to review what work has been done so far, what do we have at our disposal at this moment to start from and to base our recommendations on, so that we are sure that when we develop tips and this toolkit, that we can develop it based on the best evidence that we have at this moment, based on all the work that people around the globe have done so far, and to incorporate this then into the TAND app. And the third line, and that's one that I personally I think it's very important, I really feel connected to, is really the development of a global TAND consortium through a range of networking and capacity building and public engagement activities, but really with the idea that this project does not stick with the people that are current, that we also try to facilitate, to draw people's attention into the field of TAND research. So to make sure that in the long run, we will really gather more evidence, better evidence, to improve the interventions and the treatment and management for TAND. So you will see the same three aims in a more visual way developed or outlined here. So I'm maybe not going to in a lot of detail. So the development of this self-complete quantified version of the app, validated against the current assessments that we usually do for the assessment of TAND, build it into the app, to develop consensus guidelines, to translate these recommendations into practical tips and guidance for parents, and that will be quite a challenge. I'm really looking forward to that translation part of the project. To integrate this into the app, and with all of you, if these things make sense, if it's accessible, if it's user-friendly, if you find a way, if you think it is useful. And then the third line is really to develop this TAND consortium and make sure that the work does not end when this project ends, that this is something that will be sustainable in the long run, ideally. And this idea also is elaborated in this figure, which shows the impact loop, or the hope that we have that this project will have an impact, in the sense that by creating this TAND app and by developing the toolkit that is part of it, we will at the end of the project, hopefully be able to scale it up and to scale it out to prepare for that to different contexts, in different settings, in different countries, and as we collect more data, we will also be able to do more research and learn more about TAND and what works for TAND and what does not work, and maybe to identify, but with people who have this profile or who have difficulties in this cluster, maybe this intervention might really work, but that intervention might really be a waste of time. So as we go along, we really hope to improve the evidence base that we have. We have not a lot to start from at the moment, but we really hope that through this project, we will also learn more to, in the long run, close the loop or to keep turning the loop around and gain better and better evidence and develop better interventions for TAND.
And I can maybe just, if I can just jump in here on,
yeah, sure.
We were really struck by, in the COVID-19 epidemic, how you've seen that picture that I showed of the Johns Hopkins site, how the international community came together to pool data, to put information together to help us all understand the picture in a much more global way. And I think the technology that we're using here also will give us the opportunity to have that global picture about TAND in the TSC community. It's so hard to do this when people work on a national basis only, but when we have technological tools at our disposal, we can really make it much more large scale and therefore learn things that otherwise we would simply not be able to learn.
And so this slide just shows how that the international dimension, and it comes back to what Petrus is saying, to really, it has been such a privilege to really meet all these people that are involved in the project that come from different countries, really different backgrounds. There's a combination of people with lived expertise, people with professional expertise, also within the professional experts. I've really had the opportunity to meet people that I was not familiar with, whom I had not met in the TSC community yet, but who really have a different background in research along some aspects of TAND, in autism, for example, and that really bring to the table a lot of knowledge and a lot of expertise that enriches our discussion and our research around TAND. So there's really people from all the different WHO regions, from Latin America, from the United States, Canada, from Japan, India, South Africa, countries in Europe. So it's really a very diverse group of people. And maybe we can go to the next slide. So we met for the very first in November in Leuven here in Belgium. This is just to give you a face to the logos on the previous slide. I can just testify how strong the energy and the dynamics were when we had our first kickoff meeting. Everybody was really very, very enthusiastic, and just being able to share expertise from different backgrounds and having people with very different stories connect really created, just loosened a lot of creativity. So that has really been very, very powerful. And so since then, since we are working globally, we are obliged to work online and to connect online. So despite of COVID, we have been working through Zoom and Skype and Teams and other platforms all along. So this was us yesterday having a consortium meeting online. So you might recognize some familiar faces here, people that are on the call as well. And so I think November, looking at where we are now, so we have identified the company that will develop the app, but what has impressed me most, I must say, is the work that has been done in the different subgroups, really analyzing all the evidence and everything that has been published so far in the field of TSC-Associated Neuropsychiatric Disorders, and really go through this in depth and see how we can translate this into recommendations for decreasing the identification and assessment gap, and to really prepare the development of consensus guidelines and the translation to this TAND toolkit. So really I really look forward to coming back to you and show more of the progress that has been achieved by all these people whose faces you can see here on the screen. But it's really wonderful to feel how everybody's connecting, bringing different skills together, sharing their expertise to try and move this thing forward. I'm not sure where this brings us in my next slide. This does bring me back to Petrus, because not only we're trying to develop a toolkit and a handhold framework for people in order to reduce the uncertainty around everything that's linked to TAND. And I think some of the things that we try to use to tackle some of the COVID stress, we might also use to tackle some of our uncertainty when we're faced with TAND. So,
and maybe I can just explain a little bit about this tip. And in fact, Luke, I'm very happy to send you this as a little WhatsAppable file, and you can share it with anybody. This is a little tip sheet that we made up with colleagues in France. So the French Child Psychiatry Association and the International Child Psychiatry Association and the South African Child Psychiatry Association came together, and you will see at the bottom of the slide also with Autism South Africa and our team here at University of Cape Town, because families said to us, we are so overwhelmed by information in this time of COVID-19. We're so overwhelmed by people saying to us, do this, do that, don't do this, don't do that, that what we wanted to do was a simple, and it's called, the technical term is a thematic analysis. So our colleagues in France looked at all the information and all the tips given by people about what you should do in the time of lockdown, in time of confinement. And they identified the 5 key themes from that. And what we did was we just presented these themes in a way that we thought would be simple and easily accessible and available to mums and dads. And I think, and I will quickly go through these tips if we have a minute, because I think they are relevant to children, but they are actually just as relevant to all of us who are still in different phases of lockdown or unlocking or what's the, what do you do, call it in Britain, shielding, that actually has similar impact. So tip number 1 is explain and inform. And that's about using age and developmentally appropriate language, honest, clear language to explain to our family members and our children about COVID. We don't want to force information on people, but we want to respond in an honest way. And there are lots of very nice tools. In fact, Luke, at our University of Cape Town website, we also have lots of nice tools. There are little movies that have been made and COVID books, and people might have seen all sorts of lovely resources. But I think it's really important just to use verified sources. That's how we manage the kind of fake news that we've all been sent. You know, I've probably had most strange news from friends and colleagues and family members who say, oh, did you see this? Did you see that? So explain and inform. And of course, it also means explain and inform and update the information as new changes happen. Many of you know that I have a brother who has developmental disability and autism. And so we've been living through lockdown with changing information with him in very similar ways to what you've all had to go through. And so it is about updating and finding clear, simple language. For my brother, the phrase word became because of the virus. Everything was qualified because of the virus. And so number 2 is secure. And securing is about reassuring our family members, being realistic, managing them, securing them not just physically and against virus and teaching them how to do basic stuff, but also emotional security. So one of the key themes during lockdown is families are together, and that's also the time that there's lots of stress. So in many countries around the world, domestic violence has gone up, child abuse has gone up, children have taken in disinfectants, people with disabilities. So it's just about thinking about how do I make sure things are secure and how do I build that into a a logical and an understandable system. The third theme is about being stronger together. And that's about paying attention to everyone at home, whoever it is at home, whoever's there, scheduling positive one-to-one time with each child per day. On their own, they get to choose what it is, and you're supposed to have fun. And the same applies to adult family members with disabilities too. Just about that moment of one-to-one focus. And of course, staying connected with other family, particularly grannies and grandpas and other elderly relatives, because older people are feeling much more vulnerable as well in these times. Pacing daily life is theme number 4. And that, and we all know it, but it's about creating a basic structure for the day, but making sure that there's some moments of surprise as well. And so it's about organizing of activities and games and exercise and whatever it is that people like. When we have family members with disabilities, changing the schedule, changing the program is a major problem for many people. And so there's really a need to say, okay, we are now in a different time. And so we're going to come up with a different schedule. And the more you can come up with that program with your family members, with your child or brother or sister or partner, the better it is. And to acknowledge, in COVID time, we can't do things in the same way. So we have a COVID schedule. And we might have a lockdown level 5 schedule or a lockdown level 3 schedule or whatever terminology is used in your country. But that really makes a huge difference. So it's also about thinking, how do we moderate the usual requirements of the day? How do we also, and this is super important for all of you, how do we make sure there are times for people also to be on their own? Mums and dads now have to do everything, mainly mums. And so when does mum or when does dad or when do we have just half an hour to ourselves where we can be quiet? And that's really important to look for and find that moment of being on your own as well, not just running all the time. And the 5th theme, which I also think is a super important one, is managing screen time. Of course, maintaining social contact through Zoom and all the other techniques that we have and Wi-Fi's and smartphones is important, but it's also important that we regulate that. Most of us, I predict, wake up in the morning and the first thing we do is to check the news. And before we go to bed, the last thing we do is probably to check the news. And it's actually really overwhelming and it's very exhausting for most of us. So really managing the amount of time people spend on movies and series and video games, managing the amount of time that we spend looking at the news. And the tip that I've given to my friends, family, and patients is to try and have a news-free day. 24 hours, no news. You will be amazed how refreshing it is. The worst thing that will happen is there will be more cases of people with coronavirus. There will be more people who've died, as sad as that will be. But it's really good and refreshing just to switch off from those kind of things as well. And the same applies to our children as well. So you can see, so this is really just an illustration of the way in which we want to try with our project with TANDem as well, translate information into things that are useful to people at home. We've translated these into many different languages now, and so we're very keen for people to use it. They're basic principles. There's nothing technically complex about them, but often it's coming back to these first principles. When we're getting overwhelmed, we say it's now 2 months. Let's just rethink. Where are we explaining why it's so long? How are we keeping ourselves and everyone secure? How do we make sure that we don't just get irritable with one another in the home and in the neighborhood and with our children? I think it's maybe also important to acknowledge that it's normal to feel like wanting to scream and shout and run away. And I think it's also normal that we feel overwhelmed and don't quite know what to do. And I suspect most of you will find that you go through phases. One day is better and another day is just terrible. And we take turns to have terrible days and we can support one another through those in different ways as well. And so I think, as I said when we started, we wanted to make sure we have some time for comments, for questions, for engagement from all of you as well. So I think with that, Anna and I might say thank you for your time, thank you for joining us, thank you for listening. And I'm going to hand back to Luke, and I hope there will be some opportunities for us to have discussion. Thank you, Luke.
Thank you, Petrus and Anna. I couldn't find my unmute button there. But yeah, that was great. So yeah, if anyone does have any questions, do feel free now to unmute yourself, or if you're having trouble doing it, I can do it for you as well. So yeah, over to yourselves if anyone has any questions.
I had a conversation, maybe just to start things off, earlier today with my team, and one of them said, do you know, it's also important that we don't just think about the difficulties because of lockdown and because of COVID-19. We should also think about the good things that have happened and the positive consequences of COVID-19. Sometimes it's hard to think of them, but I think if we focus, we actually do find them. So I'm also keen to hear if any of you have had positives from lockdown and positives from coronavirus. I'll give you one example. I work with many children in the clinic who have school refusal, school phobia, social phobia. They have loved lockdown. They've loved the fact that they could learn in their own time without all those other stresses around them. So I think, you know, if we stop and think, there are also, or can also be good things from these really difficult times. So maybe someone else can add or comment or.
Yes, I think for us, it's become less isolating in a way because Tristan, our 33-year-old son, had decided to self-isolate 3 years ago and refused to move from the living room and has to be persuaded out to do most things and only when he's happy to do so. But for Perry and I, things have changed because there are no carers coming in at the moment and it's all hands-on care here. But we have found that his behaviour settled somewhat because there's less changes as well and his anxieties have reduced. And I'm finding that it's less isolating for us because of things like this and because more meetings are coming online and we're able to get involved a little bit better nowadays because of accessibility through Zoom and other ways of meeting up.
Yeah. And thank you, Maria. And as I said, I also think there's something about how this experience, the kind of the physical experience of being in lockdown and in uncertainty, for those of us who don't have autism and developmental disabilities, how it can just give us a sense of how it might feel for somebody like Tristan and others on a daily basis, you know, why they might not want to do things, why it's hard for them to tolerate all these kind of things. Because if this is how it makes us feel, we can imagine how it also might make many people with various disabilities feel.
I was going to ask about the app, if you don't mind. I think wonderful idea, and it will give families control to a degree over the information, and also give us a record of factual information with what we're gathering as regards what the real issues are, rather than what we perceive to be the issues at that particular time, because there'll be a record there. But how is the app going? How are we going to engage with local health providers for them to take on board the information that is generated with the app, and how is that going to be done across the countries, so that there is an equity from the services or the support that people will have by using the app? Great.
Andy, you want to take that one?
Yeah, it's a good question, and it will definitely be have been already discussions about this topic exactly, to see if it would be possible, for example, to if you fill out this self-complete version and a quantified version of the checklist on the app, to then indeed make sure that it can be shared with the physician who does take care, to keep this dialogue going, because we do think that it is important, even if you fill it out yourself and there is a toolkit for self-help, that there is still a dialogue ongoing with the physicians and the team that is supporting you and managing the TSC. And we just hope that it also will empower families to really show the team, like, these are the things that we have been facing. These are the things that we have tried to put in place ourselves, but these are things that are still difficult to manage. And can you help identify the people who could guide us? We just hope that by already preparing this and quantifying this a bit more, that it is not overwhelming also for the teams and for the physicians, just to say like, because I think that this is often also from our side of the story, and some of you might heard this earlier, but when families fill the checklist with us, with the physicians, sometimes at the end we think like, now we have asked all these questions, and what should we do? We don't know. And so sometimes I think also physicians are just afraid to have this overwhelming information and overwhelming call for help from the families. And sometimes I think they just are rather try to not to ask the question because they're just afraid of not being able to come up to the expectations of the family.
Yeah. And I can maybe just add, Marie,
by quantifying and by being, well, it's good.
No, go on. I interrupted you. You were busy.
No, just to emphasize the fact that by pinpointing where are the biggest priorities for which issues have the biggest impact, and this can change over time, but that might maybe also help the physician to say like, but this thing maybe I can do something about, or for that, let's talk about this first. Let's try to handle this first. So that might be ways that we think now that this might help. But this is a process that is being developed and that will be developed with all stakeholders in the community. So we don't have the answer up front. It will come from interaction with all of you to make sure that we learn the best solution to tackle this.
Yeah. What I was going to add is just our principle number one is we want the information to be in the hands of families and people with TSC. So we want you to be able to share it with doctors, with therapists, with other people, but we don't want them to have access to this information unless you choose to share it. And we just thought, that was just the philosophy of the whole project, that you can press a button and it'll email a PDF of it to your doctor or to yourself. The other thing that we want to build in is if you go in and you do it once and then you update it, it will give you an ongoing record for yourself. So for you and for doctors and others, it'll chart the kind of TAND profile. But I think what your question also points to is we've decided to start with empowering of families and people who live with TSC, but we cannot forget that we also have to work on the doctors and the clinicians and the professionals as well, because we know that you are already all much more expert than they are, so we shouldn't forget about them. And therefore, we also need to think, how do we build educational and training things for professionals about TAND through the TANDem project, even though that's not the primary purpose of this particular TANDem project. But we have those ideas in our minds, and you'll make sure that we get there. I saw that Katie had her hand up earlier.
Hallo, hoe gaat dit met jou vandaag?
Oh, baie goed, dankie, Katie.
I used to live in Cape Town when I was little.
Marvelous.
And I met you a very, very long time ago when you and Deborah, were doing things. So it's been a while. But I was just going to say, I'm quite looking forward to the app actually, because I'm in a position where I have tuberous sclerosis, but I also have functional neurological disorder. And I was trying to explain to the lady who's helping me with my FND about TAND. And I think it would be really useful that I could bring like some information so I'm more holistically looked at, rather than there's FND over there and there's tuberous sclerosis over there, because I'm fairly certain there's probably some interaction between the two things because of having TS as well as FND. So it looks, I'm quite excited about it.
Thank you, great. And as I say, it was really a project that evolved through our work in the TSC community over a long period of time, and the ideas and the suggestions really came from families. This wasn't something we made up. It really was from the ground up that people said, this is what we need, and what you have to keep us to is to make sure that we make a product that will be useful to you, not just that'll be some random tool. And as you know, Louise and the TSA and the team are very supportive and are also co-funding the project. So they're very project partners in this whole business. Oh, and Tonya has a hand up. Hello, Tonya.
Hello. We really welcome something like this. Our daughter is in the middle. She's in the middle of severe and mild. And we go to appointments and things like that. We've emphasised quite a lot with TAND, because Georgia has TSC, she has epilepsy, but we struggle more with her with TAND. And we get things like, well, she can talk, well, she can do this. And what I've tried to explain to them, there's a difference between talking and understanding what you're talking about. And one thing we really struggle with is emotional regulation with Georgia. And they'll say to me, well, just say this to her. And my argument is, how can you explain that to someone when they don't understand how they're feeling? But they say to me, take Georgia to the board and say to her, what do you feel? How does Georgia tell me when she doesn't recognise that she's nervous about COVID or she's nervous about going outside? Because she can't recognise that because of her issues.
Yeah.
It's so hard to deal with.
Yeah. And just for your information, unmentioned earlier about the 7 clusters of TAND difficulties that we've identified. And one of the very definite clusters is what we now call dysregulated behavior. So that's the kind of sudden temper tantrums, sudden aggressive outbursts, these kind of dysregulated emotional things that you talk about. So and you can see Stacey there on the screen as well, also works in Birmingham and is also in the TANDem project. And we're really focusing on finding ways to help people understand, how can I understand my child's dysregulated behavior, and then what can I do to help them manage it? Well, for me to manage it, for them to manage it, and for other people to manage that. These things are complicated, but we're always encouraged to...
I think it's giving also the professionals the confidence to understand as well, because I think some of the things that people that we meet their answer always is to us, well, she has TSC. And as a parent, that doesn't help me. I can't get the ball of TSC and give it to George and say, take this pill. It doesn't help me as a parent. and
as a doctor who's been doing TAND research for the last 22 years, it makes me very depressed to hear people still say that. She has TSC and she has TAND, and she has all sorts of bits of TAND, and for each of those bits, there's something we can do. And that's the message we want them to get. So you're all reminding us we need to keep working at both sides, and we're also going to have a website for the project. And maybe I'm looking at Anna and Stacey, maybe we should also think about how maybe we can draw the attention to the professional community, perhaps through the website, to alert them and inform them about some of the information and the project and so on, so that it's a kind of a joint learning venture. I see the peacocks, but I'm also looking at Luke. Luke, it's 7 o'clock in the UK. You need to tell us when we're all going to turn into pumpkins. But I'm very happy to take one more question if we can.
Yeah, that's absolutely fine. One more question is good for us. Yeah.
Sorry, it's Rachel, by the way, not just generic.
Hello,
peacock.
Rachel. No, we could only see peacock.
Yeah, no, that's fine.
Look, and as you heard earlier, Paul was very worried that somebody was called iPad and somebody's Betty Boop. So, there could be many more embarrassing names on the screen.
Absolutely. I was just going to say that I think awareness of TAND is really, there isn't much at all, even amongst professionals. I think only one consultant that she's ever seen has even used the expression. She's been assessed for autism. She has autism. She has a speech disorder. She has learning difficulties. Everything's very splintered. Nothing is textbook. Nothing's travels along a route that you'd expect it to, but it's never mentioned. So I just think that this will be really helpful for us in sort of broadening that understanding, but also our own as well, because I think we've been very streamlined because professionals haven't mentioned it. You know, we're like, oh, well, is that because of our autism, or is this because of this, or is this because of that? And I think trying to combine it all together and understand that it's almost a separate condition, that makes sense.
Sure. Yeah. And that's in part why, so in 2012, we coined this term, TAND. And in 2015, we published the TAND checklist. But it really is an ongoing process. So some, you know, it's always like that in healthcare and in any professional system. There are some people who take up the information very quickly and they apply it. And then there are others who are a little bit slower, and then many others are very slow. So I think we also, the project gives us an opportunity to help with that information sharing and dissemination. Yeah. I think we all have an opportunity to use that. So we're always very keen. So you will see that all the papers that we've written about it are open access, which means you can go to the internet and download them. And I say to mums and dads, you know, take it to the doctors, show it to the doctors, because at least it's something that they will recognize as a, you know, a scientific peer-reviewed thing. So the checklist is free. It's now available in 17 different languages. The paper about the checklist is freely available, and I'm sure it's linked, and we can make sure that that's available. And we also, a year or so ago, wrote a kind of a updated summary about it, and it was written not for super expert doctors, but for anyone. So that, I mean, you can take it to all your clinicians as well, and that's also freely available. So there are 3 tools that you can use in your positive advocacy for TAND as well. And just, of course, to say, you mentioned autism, and Tonya mentioned dysregulated behaviors. Of course, we know many people with TSC don't just have one cluster. Many people have combinations of different clusters, and that's part of the TSC profile. But it is helpful not just to say, oh, it's one thing. Yeah. It is helpful to try and break it apart, to say, well, what can I do about this bit, and what can I do about that bit? So Stacey, for instance, who's on the line, is particularly interested and has done work on sleep disorders in TSC, because we know that sleeping and eating issues are also part of a cluster. So it's about then saying, well, there's the particular cluster. What can we do about this cluster? How can doctors and we do things at home, etc.? And the last thing, and maybe we should wrap up with that, is we also want to use this as an opportunity to identify gaps in where we as a TSC community should do more research. Because TAND overall, there's been very little research. And the little bit that's been done has mainly been studies that haven't had, if I can say, a kind of an implication for families. There's been almost no intervention studies. And we need to think, how can, if you are all saying TAND is the biggest issue for me, then we need to think, well, what kinds of research can we then do in the TSC community to make sure that we can help you answer those questions? So I think that's also another goal for us, to make sure that we identify the research gaps in a way so that we can really move the field forward for the TSC community. I don't know if Katie's waving, but I'm going to hand back to Luke, so that being late is not my responsibility anymore.
It was just me. I was going to say, I know TAND, it's a big thing for families, but TAND, please don't forget that there are some of us who have TSC, and, you know, we're on our own as a normal functioning adult as such, but that we can also have problems with TAND as well. So please don't forget us, like grown-ups as well.
Absolutely, absolutely. And that's why the TAND app, you can either complete it for yourself, or you can complete it for a family member, or you can complete it for your grandchild or for your brother or your sister. So we're very conscious of that, and we're very conscious that many people in our community are very able in many ways, but it doesn't mean that they don't have significant difficulties with TAND.
Thank you.
Great, well, thank you again, Petrus and Anna. It's been honestly such a pleasure. It always is, and TAND is is so important, as everyone on this call knows, I think. So as I said before, the recording of this session will be made available online. If anyone does have any additional questions, do please send them across to me. We'll see what we can do as well if Petrus and Anna are happy with that. Yeah, thank you. And yes, do keep an eye out as well for future sessions. I'll give a quick plug while we're still here. So we've got Carers UK on Wednesday, and then the following Wednesday after that we have Anxiety UK speaking for us as well. So yeah, so without further ado, I think we can call that the end now. So again, thank you very much to everyone who was coming, and thank you again to Petrus and Anna.
Luke, on before we all go, on behalf of the TSA's board, let me thank you for getting the techie bit up and running. Petrus and Anna for a wonderful talk this evening. Thanks very, very much indeed. I'm off now to see how severe autism and COVID-19 fit well together. In our household, not very well at the moment, but
I know.
You've explained it. Bless you both, and bless you all for being with us this evening.
Thank you, Tom. Thank you, everybody.
Hope to see you soon. God bless.
Great. Thank you. Goodbye.
Bye-bye.
Bye.
Thank you.